So this is a right anterior pelvis, and we're going to have a look at the muscle origins on the anterior side of the ilium and the pubis. And in the front of the thigh there was the Sartorius muscle, if you remember the Sartorius, and also the Rectus femoris. So these are two muscles which actually have crossed the hip joint to enter the anterior thigh. So the Sartorius muscle originates here, and this is the anterior superior iliac spine. So we call it the ASIS for short. Immediately inferior to that, there's the inferior iliac spine, and this is where the Rectus femoris muscle originates. And Rectus femoris is very special. So it has two heads. It has another head here which runs just over the capsule of the hip joint. So it can be difficult to image because this tendon is quite anterior and superficial, but this one turns direction and runs very deep in against the hip joint. It is possible, but it's very technically tricky. The other muscle that included in the adductor group is the gracilis muscle, and the gracilis muscle originates here. So this ASIS is a very important landmark. These days we're performing injections of the lateral femoral cutaneous nerve. So it's a little nerve that passes out medially to the ASIS and deep to a ligament which runs from the pubic tubercle to the ASIS. And that's known as the inguinal ligament. So it forms an important boundary of the femoral triangle along with the Sartorius muscle that originates at the same point. So the inguinal ligament is running anterior and superficial to the femoral vein artery nerve. And the vein is always most medial, followed by the artery, followed by the nerve. So this ASIS is a very important landmark to be able to find.